Hi students, Dr. Sharon Medcalf here as your guest lecturer this week for Dr. Brandon Grimm's Leadership and Advocacy class. I am going to give you a brief overview of the Incident Command System, which some of you may actually be aware of if you've ever been involved with emergency management or the fire service, for some of you that have, and in fact that's where it originated, but we'll talk a little bit about that. My goal is just to give you a basic understanding of the concepts of the incident command system. And I always tell public health students that if you ever end up working in a local public health department or even a state public health department, you're actually going to be expected to understand the incident command system, because if an emergency of any sort happens in the district that you're in, it's usually all hands on deck. And to understand how that system works will make you better able to integrate into other systems as you work through that, whatever public health emergency that happens to be. So I guess I have to back up a little bit and talk a little bit in generalities about the national response framework in this country. So what I want you to understand is that if an emergency happens, the emergency manager in that given area does, the first thing he or she does is they take a look at what has happened with this particular disaster, and they decide who they need to help respond to the disaster itself. And the system that's in place right now is that we have 17, sometimes you have 15 here, but they add and they take away as the years go by, emergency support functions, or ESFs is what we call them. So pretend you're the emergency manager of a given district. Let's say it's here in Omaha, and let's pretend a tornado happens. So what I would do as the emergency manager is I would say, okay, which of these ESFs that I have listed here am I going to need to call on to help respond to this disaster? So let's look at transportation, which is the first one. Chances are, if it's a bad tornado, there's likely a lot of debris in the streets. We're going to need big equipment to help clear the roads. So that would be Department of Transportation. So I'm going to need ESF 1. And then so on down the line. So I look at firefighting. Chances are that there are gas lines and perhaps fires in this particular tornado after the fact. I'm going to need ESF 4. I may have people whose homes have been destroyed and are going to need temporary sheltering. That's mass care, ESF 6. I know that I'm probably going to have some injuries and that the healthcare system is going to be overwhelmed. So I'm definitely going to activate ESF 8. So this is exactly what happens in a disaster, is that I decide as incident manager, who do I need in my emergency operations center to direct that response? And so I call on 1, 2, 3, 5, and 8, and representatives from those ESFs, which are representatives of agencies, will come to my emergency operations center and help me run this disaster. So that's kind of laying the groundwork a little bit for what happens in there. An example of what one of the ESFs, and I picked ESF 8 because that's the public health and medical, these are just some of the jobs or responsibilities that are inherent to ESF 8. So you can see public health and medical needs, you can see medical care, patient evacuation, patient care, safety and security of drugs, biologicals, and so on and so on. And it seems like a fairly exhaustive list of items that are responsible, that the ESF 8 agencies are responsible for. And by and large, ESF 8 is usually led by Health and Human Services. So that may be your local public health department, it may be your state Health and Human Services, or it may be a federal Health and Human Services, if that's the case. So each one of these ESFs, or emergency support functions, also has a list of responsibilities, and then they usually have a primary agency that directs that, and a secondary agency that might provide support. So let's talk a little bit about the incident command system itself. It was actually developed in the 1970s, and it came about as a result of the California wildfires that, as you all know, continue to happen year after year here. But what they do in a wildfire, particularly in California, and have done forever, is that they usually call fires services from across the nation to help them. because these things last, as you know, for weeks on end. And what was happening in the 1970s is that all these fire services were coming to the scene in California. They all come with their own lingo. They all come with their own way of doing things. There was no clear-cut way to keep track of who was where and how much equipment was being used and who owned the equipment and who was getting the equipment and so far and so on. So there was really no management structure to be able to manage all these different entities with different sort of cultures of their own arriving on scene to do the same job nonetheless, but they're still coming from different vantage points. There was no chain of command per se other than what happened within each individual service, and there was really no way to communicate really well amongst the different players of the response per se. And then there was nobody really tasked with thinking ahead or that connection between the different agencies. So I think you're sort of getting the sense here. So what they did is they borrowed the system actually from the military, and those of you that have some military service can probably relate to this. And that's sort of where the concept came from, and then it was refined as that continued. So here's a sort of a diagram of the organization or the management structure itself. And as you can see, it has 8 different roles. And this is really how all incident command structures are structured in this country, is they all have these 8 roles right here as part of their command structure. And these 8 roles are usually all together in an emergency operations center, an EOC. So that could be a designated place that is perhaps for a city. So for example, the city of Omaha's EOC is run by the emergency manager here, and that EOC is actually in, I think it's in the Civic Center downtown actually. The state of Nebraska Emergency Management has their own EOC, Emergency Operations Center, and that's actually located in Lincoln. And they're well equipped with lots of computers and lots of stations, but every single EOC will always have these 8 roles as part of the way that they operate. So there will always be an incident commander. There's always going to be a public information officer. There's always going to be a liaison officer. And all of these bottom areas that you see next to what they're called general staff all have people that report to these section chiefs as well. So that's the whole beauty of this structure, is that it's the very same everywhere. And the job duties for all of these 8 roles are very similar from place to place to place. So let's start with the incident commander. So the way that the incident command system works is that you don't actually always have to activate all the roles. If it's a large enough emergency, and it doesn't even take that large of one to really need all 8 roles, then they'll all be there. But sometimes it's something small enough that maybe the incident commander only needs 1 or 2 people to help them, and he or she may only need the liaison and maybe safety, but who knows. But there's always an incident commander. So that's a position that is always, always, always activated. And as the term sort of implies, it sort of has overall responsibility for what's going on. The incident commander then activates these ICS, Incident Command System positions, and then appoints people to those roles. Now, typically, in a well-orchestrated Emergency Operations Center, EOC, all the people that are going to play these 8 roles already know who they are. And in fact, what we typically do is we usually have them 3 deep. So we try to have 3 people who can act as incident commander, 3 people that can act as liaison, 3 people that can act as, logistics chief, et cetera, et cetera. So that way you have, if the person that's the main person isn't around, you have someone to fall back on. And then you always have that sort of 24-hour coverage if you should need to do that. So you could also add a 9th role, and I'm not going to talk about that till the very end of the presentation, but we call those technical specialists, and we'll really talk about where they are in that command structure and who they kind of report to and when they would do that a little bit later in the presentation. So the incident commander should be the person that's really the most qualified and the trained. It has nothing to do with rank. It has nothing to do with grade or seniority. In fact, if we talk about, often we talk about hospital emergency operations center and the incident command system, And the last person you probably want in there is your CEO of the hospital. Believe it or not, you really want someone who's trained in the role of an incident commander, who understands the structure of incident command and knows how all the other pieces fit together and how they work together. So that's really important to think about. Again, the incident commander is responsible until all the authority is delegated to another person. So he or she might be the first on scene or might be the delegate for that role, but they cannot leave that role until they've delegated it to someone else. Now, at the bottom here, you're going to see that command structure reappear on every slide. And what I do is I highlight the different roles as we go through. So the command staff, or who we call those top four: incident commander, public information officer, liaison, and safety. And then the general staff are those section chiefs that you see at the very bottom. So let's talk about the public information officer next. So this is the person, and the only person, who is your conduit to information. So this is the point person for all communication that is both internal, and that, let's say for a hospital, let's use a hospital as an example, your PIO, public information officer, is the person that does all communications internally to staff, visitors, patients, and families. They're also responsible for all of the communication to external partners. So that's where the news media would come into play. So for instance, when we had Ebola patients here in this hospital in 2014, we had a PIO who did all the communications, wrote all the letters to families and patients that we were going to be housing a patient with Ebola. And that person also was responsible for setting up press conferences for local media, et cetera, and national media on campus. So very, very important that that be a point person for all information, because what often happens with media is that they'll grab anyone who's willing to talk and tell the story. And we definitely want someone who is trained to be able to give the right information, be credible, be right, and be first. So those are some basic skills that a PIO, public information officer, will be able to convey. Safety officer is the last one, or is the next one in the command staff, and that's the person that is completely responsible for everybody's safety. So safety of the staff, and again, this is a hospital example, safety of the patients, visitors. They make sure that conditions, hazardous conditions, are being adhered to, that they can really make sure that people, let's go back to our tornado example. If for some reason the building here would be hit by a tornado, it's the safety officer who would decide if responders can go into a certain area or not. So that's that safety officer's call, and they can halt any operations if they pose a threat to life and health. So that their role in something like a structural damage tornado, something like that, would be, as I mentioned, if we had an infectious disease, your safety officer would be the person that would make sure that, your, in the hospital example, that your staff all had personal protective equipment and those types of things. So it's all comes down to the safety of the responders and how their safety is taken into consideration. Liaison officer is the person who, again, kind of self-explanatory, is your person that's going to liaise or connect with other outside agencies. So if I'm the incident commander, I need to find out what my state responders are doing, or if another agency across town, if I need information from them or anything, I'm going to ask my liaison officer to make that connection with all the other agencies that would work with me in responding to a disaster. Often the liaison officers establish those communication or those relationships earlier on so that they're not doing it at the time of the incident. So for instance, if I'm the liaison officer and I know I'm going to play that role, and in an infectious disease event, I know that I'm going to need to be in touch with suppliers or anyone who would be involved, that I'm going to establish those relationships ahead of time so that I know who I'm calling and I know who to ask for to get what I need to do or to get information about what I need in a disaster. So that's the liaison's job. So this is, again, another picture of the structure, and you'll see this time and time and again, and it's just important that you kind of see that these are the main roles in that incident command structure organization. Now we're going to the bottom part of this structure and looking at the section chiefs, who are what we would consider general staff. Operations section. So this is the section for whom their mission is tactical operations. So if I'm a hospital, my tactical operation is basically taking care of patients. If I am a fire station, my tactical operations are putting out fires. If I am a public health department, my tactical operations are making sure that I am providing for the public's health. So it's all the same, and that's the beauty of this system, is that it doesn't matter what your mission is or what job you do. That's the operations section's responsibility, to make sure that that keeps going. So they write the objectives to make sure that let's use the example of the hospital again, that our objectives of taking care of patients are met, and I, as the operations section, I'm going to direct how all the resources are going to be used to make sure that that patient care continues in a disaster. So they're usually the largest section, and I'm not even showing you the pieces that come below that. I'm just really covering the gist of that, the mission of that basic section. Sometimes, just to put it in easy terms, we call the operations section the doers, because they are basically doing whatever your operation or whatever your organization does. Again, hospitals taking care of patients, fire departments putting out fires. So they are the doers. The logistics section are the people that provide support to other sections. So if I need a resource, I call the logistics section chief and say I need a resource. So back to our hospital example, if I'm the operations chief and I need to make sure that I set up more beds to take care of more patients who I know are coming in from the disaster, I'm going to call my logistics chief and say I need 20 more beds, and I need you to get me staff that can staff this bed. I need you to find me supplies, etc. So that's what logistics does. They are the people that go get what you need to do what you do. So the doers of the operations, the people that go get things, are our logistics. Now here are a couple more things that fall under logistics. When you have assigned personnel in a disaster, or responders on a scene, let's say, logistics is responsible for making sure that they're fed, that they have communications, that they have medical support, and they have transportation. So let's come away from the hospital example, and let's go back to maybe a community emergency management agency, and a tornado goes through the community, and you've solicited all these people that are going to help in the response to, initially, probably going out and doing search and rescue. So you as logistics have to make sure that all those responders that are in the field doing that search and rescue are, again, fed, have medical support, are transported to the area, etc. So that is your job in the grand scheme of things. Planning section, kind of also self-explanatory. Those are the people that should be thinking a day, a week, a month ahead of time in what's going on in this disaster. Your operations people and your logistics people are going to be caught in the moment. They're going to be making sure, number one, that you're saving lives and making sure that people are okay before you start that recovery process. But planning section has to be thinking ahead to, what happens tomorrow? What's going to happen the next day? When these people get tired, how are we going to find new people? When our supplies start dwindling, how are we going to get more supplies? So I'm thinking ahead to what we need. I'm looking at what we have. So under the mission here of the planning section, so what they do is they collect, evaluate, and disseminate all this information and intelligence to the incident commander. So I'm telling the incident commander, okay, I'm thinking ahead. We have in our inventory of supplies for, let's say it's an infectious disease event, I have 1,000 gowns, I have 5,000 masks. I know that I'm using these to the tune of 100 or 200 a day. So 5 days from now, I'm going to have, so you get the gist of it. I'm sort of thinking ahead to make sure. I also, one of the things that the planning people do is that they actually document what's called the incident action plan. And we're not going to get into too much depth here in terms of what that is, but that is kind of like the guidebook to what we're doing at different intervals in time. So for, let's say, a tornado event, an incident action plan for the first couple of hours might involve all the things you're going to do in the first 2 hours after that tornado hits. That's your incident action plan, and the planning section are responsible for documenting that. Now, once that 2 hours is up, then your team will come back together and they might plan for another 2 hours, or they might plan for 6 hours. But that's how incident command works, is that you get together, you plan for a specific period of time, which keeps everybody on the same page in terms of deciding what you're going to do now. And then when they're finished with that, then they get together and they plan, okay, now what do we do the next operational period, whatever that is. If it's a slow-moving disaster like an infectious disease, that 2 hours might be 2 days, and that 6 hours second period might be a week. So it really does change depending on what the disaster is. And as it says here, they're also planning for when things are done. I mean, how do I demobilize all of these responders and stand them down and get back to normal operations and those types of things. So the nice thing about having a planning section is that you could really have operations and logistics focusing on the here and the now, and knowing that somebody else is thinking ahead to what's tomorrow. And then lastly, you have the finance and administration, and those are the money people. Those are the people that are responsible for figuring out what kind of resources that you called on and who's going to be paying for that. Probably most importantly, if this disaster becomes a disaster that is declared as an emergency by the federal government and is rendered eligible for assistance, financial assistance from state or federal governments, if you haven't documented absolutely everything that you have done, you will not get reimbursed. So although in the initial stages of a disaster, finance takes sort of a minor role, I'm here to tell you that when all is said and done, they're probably some of the most important people when it comes time to take stock in what happened, to start charging people for resources that were brought to bear, and to be recouping financial resources for the activities that you've done. So when we do exercises, finance always feels like they're a little bit left out because you're always caught in the moment of the response, but they play a really, really huge role in making sure that the right documentation is done and that everybody is compensated when it's all said and done. So very, very important. I mentioned earlier that I was going to touch on what's called a technical specialist, and basically what that means is that if you have a specialized event, and the ones I put here would be if you have a particular infectious disease event that you need that expertise from an infectious disease specialist, then you want to call on them and have them in that incident, in that emergency operations center as your sort of go-to person for valuable information on that particular incident. If it's a chemical event, you might want a hazmat technician because they're the experts in chemicals. And then if it's a radiation event, let's say with a nuclear power plant or whatever, dirty bomb, you are going to want radiation experts because that's not expertise that a lot of people have. And so you want those people sort of on call and ready to call into that emergency operations center to help you make your decisions as an incident command team and to make sure you're making the right decisions. So you may put that technical specialist up there with your command staff and your incident commander. You may have them down in operations. You may even have them down with finance and administration. It just depends on where you want them and what type of information you're going to need from them. So I won't say any more about that other than that's just sort of that add-on job. And you don't always have them in your incident command structure, but it's good to know that they're there if you do need them. So that is, honestly, I think that was a 24-minute overview of incident command. If this is the first time you're hearing it, know that this is not necessarily an intuitive concept, but the more you hear about it, the more you'll become familiar with it. And you can spend, I mean, there are incident command system classes that last weeks on end, believe it or not. It's just a really intricate management structure, but I wanted you to have an overview so that if you are in a situation that you're in a local, state, or federal role somewhere down the line, you're going to be expected to understand, for sure, to understand the incident command system. And I know that Dr. Grimm is going to speak to you a little bit about how leadership, the philosophy of leadership and leadership qualities influence the different roles. And I think that's a really interesting way to look at the incident command system. And I don't think a lot of people have studied that. I think it would be an area that'll be very interesting because this system, although it's rigid, albeit flexible, I think there's a lot of room for study and for growth. And it doesn't always work like a well-oiled machine in every situation. It takes a lot of practice. Sometimes it takes the right people. And I think that what you're doing is you're going to be studying the right people for those right positions. So hopefully we've given you enough to get you started. And I think I'm going to join you again later in the semester. So enjoy your semester.